Hair loss treatments can be divided into surgical, which is a hair transplant, and non-surgical hair treatments. When a person is losing hair and has not developed baldness, then non-surgical hair treatments are used, like finasteride, minoxidil, PRP, lasers, physiotherapy, etc. If an area has developed baldness, that means a given area on the scalp has lost its roots, then medical hair loss treatment is not effective, and thus a hair transplant is the treatment of choice. Many a times we do a combination of the two because a person has areas which are bald and areas which are balding. So in such scenarios, a combination of hair transplant and medical hair loss treatment is used, and they are synergistic. They give you a better effect. So though a hair transplant is primarily done for men, in certain scenarios it can be performed on ladies as well. Number one situation where a hair transplant is performed in a female is when a female has a broad forehead, or because of excessive time or tight ponytail, the hairline has receded back, which we call the tractional alopecia. So when we want to lower down the hairline, a hair transplant works very well even in ladies. Second scenario is when a lady has advanced female pattern hair loss, particularly when this area appears almost bald. Then under certain situations, in certain specific cases, a hair transplant can be done in female pattern hair loss on the forelock area to improve the frontal appearance. So yes, hair transplant is possible even in ladies. There are certain conditions where a hair transplant is performed outside the purview of pattern hair loss. These are scarring alopecias because of certain diseases, or acid burns, thermal burns, surgical scars or trauma scars. It can also be done in long-standing cases of alopecia areata, where medical treatment has not worked and the patch is stable for more than 2 years. Certain special conditions where a hair transplant is attempted is vitiligo or white spot disease, where black hair are planted in the white spots and slowly the white spots gain their color back. So these are certain situations apart from male pattern hair loss where a hair transplant is successful. Alright, so post-COVID hair fall, something which has become very common and is a matter of grave concern for most of the patients who are suffering from it, because after a couple of months of COVID, many of our patients are experiencing heavy hair fall, in which they may lose up to 50 to 70% of their hair. So situation is pretty scary. But worry not, post-COVID hair fall gets treated on itself. It's a self-limiting disorder, and the hair that you lose will all come back. So not to